السلام عليكم. في ناس بتعاني من الدوخة. إذا حرك وضعية رأسه، مثلا كان نايم وجلس أو كان جالس وتحرك بسرعة بحس بدوخة. رح ننزل بعض الأشياء تحكي عن الموضوع هذا. جسمنا أو الأذن عبارة عن جهاز أو عبارة عن مكان بحافظ على التوازن تاع الجسم. فيها نظام ربنا خلقه حتى تساعدنا في التوازن. بالنسبة للدوخة اللي بتصير لما الواحد بيتحرك بيكون نايم وبيصحى بغير وضعيته أو بيكون جالس بغير وضعية الرأس بشكل عام. شوفوا هاي الأذن الداخلية هون في هذا المكان، هاي اللي بأشر عليه في الماوس. هون في عنا حبيبات كريستال. هاي في كل فترة بصير فيها تغيير. في بعض الأحيان بسبب مشكلة معينة الحبيبات هاي تطلع من مكانها وتتحرك في القناة هاي. فالأصل إنه ما تكون هون. إذا دخلت في القناة هاي فبصير مع أي حركة تتحرك من مكانها. طلع حركة الرأس كيف طلع حركة الحبيبات هاي الحركة هي اللي بتعمل الدوخة. أوكي، هلا اللي إحنا بنعمله في العلاج الطبيعي ممكن ببعض التمارين وبعض الحركات بنعملها للمريض بنحاول نرجع هاي الحبيبات لمكانها. أوكي، لمكانها الطبيعي اللي هو هون. أوكي، راح أنزل بعض المقاطع تحكي عن الموضوع.
Placed into the posterior canal of the inner ear, Bppv dizziness occurs. Fluid movement occurs due to the crystal rather than head turns, causing the brain to think movement has occurred even though none has happened. The Epley Maneuver is performed to treat this posterior canal Bppv. With head movement, does fluid within the inner ear also move, informing the brain that a head turn occurred. However, should a crystal called an otolith gets displayed 45 degrees from the horizontal. When performing this maneuver, another individual can help with these position changes. The maneuver degrees accomplished by having the patient turn onto their side, which is then held for another 30 to 60 seconds. At this point, the head should be turned 60 seconds. The head is turned 90 degrees to the opposite side and held for another 30 to 60 seconds. The head is then further rotated another 90 about 20 to 30 degrees. If Bppv is present, eye twitching called nystagmus will occur. After 30 to 60 by trying to get the loose crystal out of the canal. This maneuver is started by turning the head 45 degrees and the body laid back such that the head is extended. It is also important that the head positions are angled correctly, or else the crystal will not settle to the correct position in the canal and the maneuver will fail. Dependent position in the canal. If turns are made before the crystal has a chance to settle, the crystal may fall back the wrong way and the maneuver will fail. Manipulate the crystal to fall towards the canal opening. With each position change, it takes about 30 to 60 seconds for the crystal to settle into the most. Is then completed by having the patient sit up. So what's going on with these position changes? Essentially, the head is moved in such a way to manipulate out of the canal. The dizziness should resolve if due to posterior canal Bppv. Also, if the position changes are done too slowly, the crystal may not settle quickly enough from lack of momentum and the maneuver will also fail. Once the crystal
Vertigo or dizziness can be a very intense medical problem that has many different causes. If you have vertigo, it's a good idea to get in to see your doctor to see why it's happening. We're going to talk about the two main causes of vertigo, and then we're going to look at some exercises that can really help make you have less dizziness if you're suffering from vertigo. If you look at the sense of balance, it really depends on your ears, your eyes, and your sense of touch. But deep within the ear is the vestibular system. And the vestibular system consists of two otolithic organs and then the three semicircular canals. Now, deep within the semicircular canals are these little hair cells, and these hair cells are covered with a fluid after like a bad viral infection, and luckily some of these balance rehab exercises that we're going to talk about can really help. The main exercise is the Brandt-Dardoff vertigo exercises. So whichever position creates the most vertigo, that's where you start. So if it's the left, you turn your head to the left, and then you go ahead and lay down on your right side, looking up at the ceiling. Now you want to stay in this position for about 30 seconds past the time that the dizziness goes away. So the dizziness goes away, and then you can go ahead and count 30 seconds, and then you go ahead and sit up. Sit up slowly, wait till the dizziness passes, and then you're going to go to the other side. Turn your head to the right, and then lay down on your left side, looking up at the ceiling. And when you move, when your body moves, these hair cells move and the fluid moves, and that sends a nerve signal to your brain, letting your body know what's happening. Now, with the main causes of vertigo, the problem lies with these tiny otoconia, these little rocks that are in the otolithic organs. With benign paroxysmal positional vertigo, these rocks, they move from the place where they're supposed to be up into the semicircular canals. And when they up there, they create this surge of dizziness. These usually last a minute or two, but luckily with these exercises, we can move those otoconia down into the place where they belong. Another cause, vestibular neuronitis, is where the nerve itself gets irritated. Now, this kind of dizziness is much more intense. Often you have some nausea, it lasts for hours, it often happens, and you wait. Wait for the dizziness to pass. Once the dizziness has passed, you wait an additional 30 seconds, relaxing there, and then you can go ahead and sit back up. You don't want to do it too early. You sit back up, and then you wait. And it's really best to go ahead and do these exercises 2 to 3 times a day. And you can do that for about 3 weeks. When you do it for 3 weeks, what it's going to do is it's going to just move those otoconia out of the position that they're in the semicircular canals, and that's going to help you have less of these vertigo symptoms, because these things can go on for several weeks. So if you have the vertigo, get in to see your doctor to see what the cause is. If you need to do these exercises, do them for 3 weeks, and it can really help you have less dizziness.